Welcome to the Ambulatory Healthcare Today Podcast, hosted by NextGen Healthcare. Accelerate your success with insights from a multidisciplinary team of healthcare experts as they discuss an array of topics. These timely discussions can help you better navigate the challenges of running your ambulatory care practice. Here is your host.
Hello and welcome to the Ambulatory Today Podcast, hosted by NextGen Healthcare, leading provider of innovative healthcare, technology, and data solutions. I'm David Sides, the CEO, in my very first appearance as guest host of the show. I have a fun and important topic to cover today: how AI is transforming the EHR and other core health tech solutions. I'm especially excited because I get to have this conversation with Diane Kay, our Chief Product Officer, and Sanjeev Kumar, who's our Chief Data and Analytics Officer. Diane and Sanjeev, thank you for being here. Welcome. Sanjeev, you've been a leader in artificial intelligence since long before it was a buzzword and popular. Can you give us a short history of AI and connect that to how we've arrived at today's AI applications in healthcare?
Yeah, sure. Thank you, David. And it's a pleasure to be on the pod with you and Diane today. But I'll try to keep this brief and touch upon the key highlights across the decades that got us here. So in the 1950s was essentially the dawn of AI, where it all started with key figures like Alan Turing, who proposed a Turing test, and other key founding fathers of AI like McCarthy, Simon, Minsky, and Newell. And they helped define AI as a science as we know it now. The 60s and 70s really saw the development of what's called symbolic AI, or rule systems that most people are very familiar with. And also within the healthcare space, there was a very famous rule-based expert system, as it was called, in the 70s, called MySyn, which was used to diagnose infections. And that led to the precursors, believe it or not, of today's decision support systems. But rule systems had significant limitations that led to something called the first AI winter, which was a rather scary name, but it was a period of disillusionment in the AI research community due to poor results and a corresponding reduction in funding. The 1980s saw the rise and fall of these expert systems. They were adopted and they excelled a little bit more in different use cases, and then they rapidly sort of lacked performance, which ushered in a second AI winter. The 1990s really saw the start of machine learning and statistical learning the way we know it now. And coincidentally, the 1990s also saw a rapid increase in EHRs, with HIPAA being defined, as you all know, in 1996. As more health information was being shared and transmitted, on the other side, you started to see machine learning and statistical really sort of take a foothold. So fast forwarding to the 2000s, this was the decade of big data, which you may remember, right? Big data, big tech systems to store and process all that data, which kind of gave rise to this buzz in the industry, right? And in the healthcare industry around using all the data for available applications like predictive analytics and problems such as risk scoring and population health. So now you could use all of it at once, right? And that was something that was unheard of. So really, the tech had actually advanced. The speed of tech, the size of tech, of the technology stack had improved much more so than it was prior. The 2010s really saw the introduction of natural language learning and deep learning, and that was aided by corresponding increases in performance and speed in technology. And around the midpoint of the 2010s, around 2014, 2015, we really started to see the early emergence of generative AI with the introduction of the transformer architecture, which has revolutionized AI and NLP, paving the way for large-scale language modeling, which we're all seeing today. The 2020s, in particular 2022, really saw the meteoric explosion of generative AI with LLMs, and ChatGPT is becoming a household name. And so now the historical AI journey, as I just described it, right, really goes hand in hand with healthcare, leading to what we're able to do and offer our clients today, such as ambient assist, clinical chart summarization, clinical decision support, automatic coding, etc., enabling clinicians to work more efficiently, improve diagnostic accuracy, and help enhance patient experiences, all grounded in decades of AI research and technological progress.
Here at NextGen, we created the term that the new UI is no UI. Diane, I'd love to hear your perspective on how NextGen is leveraging AI to accelerate that vision by removing sources of friction for providers, helping them work in a flexible, personalized way?
Yeah, thanks, David. It's a great question. And I love the way personally we coined that, because if you think about it, and it's interesting, this morning I was with my daughter at a doctor's appointment. So I observed what the clinician was doing and the physician was doing after the medical assistant took a lot of information, confirmed with my daughter her medications by turning the screen around on her and having her look through. The physician came in and asked a lot of questions. What was interesting is every question he asked, he literally never looked up. He typed the whole time we were there. At some point, he stopped to do the exam he needed to do. And then he went back to the computer and the keyboard and kept typing and typing and typing, asking questions. But as a patient and as a mother of a child, it was a little interesting, like, are you going to stop? Can we ask a question? We have some. And so I think what's really happened into the historic environment is that the software that the clinicians work with, the standard EHR, is simply become a data collection tool. How do I ensure I ask the patient the right questions? How do I ensure I'm collecting the right information so that I can understand and document what the diagnosis might be, what the course of action might be, what orders I should make, what prescriptions the patient might need, all while going through a series of software and workflows. When maybe what I really want to be doing as a clinician is being able to have a conversation with the patient, go through whatever my standard set of questions and asks and exams are, and have that automatically translated on my behalf to data that needs to be turned into a clinical record, or data that's required for billing. So I think what we're really contemplating here and what we're on the journey is this no UI, where I as a clinician can do my work, have an exchange with the patient, have an ambient AI capability automatically pick up what I'm saying, understand what I'm saying, translate that to the documentation, and over time listen and learn so that I know and can suggest as an AI capability to the clinician a set of orders, a set of medications, and even a set of billing codes. So our goal is to enable that clinician who was sitting literally glued and typing in this visit today, free them of that requirement and enable them to go through their day and really relate to the patients and interact and finish their day without all of that typing and headache.
Yeah, fantastic. A real game changer. Though a lot of work was happening behind the scenes, our first public foray into AI as a company was over 2 years ago with the general release of NextGen Ambient Assist in 2023. So even before ChatGPT. Today, there are so many AI scribes on the market. What are the differentiations of our ambient assist and how we're approaching it?
So yeah, AI scribes have really taken off, right? And for good reason. There are clear differentiators really based around the human toil involved. So with Ambient Assist, for example, it can save providers a lot of time and reduce after-hours charting, let clinicians finish notes in near real time or right after a visit. And that's a huge win for reducing burnout and letting them focus on more on patients and less on paperwork. Ambient Assist improves documentation quality by capturing the full conversation, including the nuances that often get missed in rush notes, making the workflow a lot smoother. And there are other differentiators for Ambient Assist as well, which include sort of automation with AI, no human in the loop, real-time transcription with very low latency, so you can get notes generated within 20 to 30 seconds after a visit, and you get multi-language and accent support for over 35 languages. And the AI is not trained with your data, and there's no patient data stored on servers.
I would just add, to what Sanjeev talked through there, pragmatically, what does that mean for a clinician? It's all recorded. And I think some of the differentiation, I think you asked a little bit about differentiation as well, David. There's a lot of tools on the market today. I think in terms of how accurate they are at understanding and understanding the conversation and being able to translate that into the right language and order and sequence for the clinician. Importantly, too, integration is important. How do we take that and integrate integrated into the actual software on behalf of the clinician. So there's none of this cut and paste. I know there's a lot of tools out there, and sometimes they're good, they're accurate, but they're sort of requiring people to do extra work to cut and paste. So I think accuracy is important, and how the folks you're working with are leveraging the insight and information that's enabled via Ambient to be integrated and really automated for the clinician. I think in terms of orders and medications and coding, I think it's essentially, and Sanjeev, you can help me out here, understanding and over time learning based on this type of encounter and this type of inpatient and the understanding of their history, what would be a typical order in terms of, based on the diagnosis of this patient and their history, what would be a typical diagnosis that we have collected the information on through this ambient note to suggest, is it this diagnosis? Similarly, for typical patterns of orders or medications, based on the patient's history, based on this note, what would I typically be ordering for this patient, and making that suggestion? And really important today too is still to acknowledge that at the end of the day, it's still the clinician ultimately approving the orders and the codes, but that's this really informed suggestion that is enabling the clinician to move much more quickly through their work. Did I get that right, Sanjeev?
Yep, you sure did.
Yeah, so it's not just the AI scribe or documentation. It's gone beyond to filling out even more tasks that are toil today for orders, for labs, medications, et cetera. So really automating that piece. Great. Let's look at the back office and billing, or revenue cycle management specifically. How is AI reducing accounts receivable days and minimizing claim errors? What's that mean for the financial health of the practices, of physician practices?
Yeah, I'll start on that. If you think about it, even going back to sort of, when the clinician finishes their work and has, is offered a suggested code, and then the clinician says, okay, here's my code, and here's how I code this encounter or this visit with the patient, that then moves over to the whole billing cycle, right? And so there's a whole set of steps and processes and rules that are followed to make sure that for every patient, based on who their insurer is, that there's an appropriate workflow based on that insurer's or payer's rules that is followed to enable a claim to be submitted accurately to a payer, to enable them to process it through their billing system, to enable them to send the money back to the doctor, and then provide a receipt and a way to post that payment to close out that record in that piece of software. I think all of that is a set of tasks that historically have been done with great labor, technology supported, but there's a lot of manual intervention to make sure, has the suggested code of the physician, is that the right code? Is it an optimized code? Should it be a different code? Everything from what is the claim format? How do I submit that? I think there's all these rules of engagement and manual work that's happening historically in the background. AI has the ability to, and agentic AI, to basically take those steps that a human being has done, enable that to be informed by large sets of data to make sure that agent is taking the right steps, and really to begin to automate all that revenue cycle process and work, knowing that oftentimes there's something that'll fall out or a human in the loop to make sure it's accurate and done correctly. But I think more and more over time, with the masses of data, we can do a Pareto analysis and say, which steps of those process is causing the most labor, the most toil, and how do we leverage AI to learn what the different payers are requiring, how to automate those various steps, when clinical information may be needed and required to be attached to a claim. That's all knowable information. And how do we leverage AI and automation to let a system and an agent know that on a human's behalf, to do that process more effectively and efficiently, to both ensure the claims are clean and accurate the first time they're submitted, to make sure if any follow-up is required, that can be automated. And in the event of a denial, that can also be automated. And the next step on that claim, documentation, referrals, et cetera, is included on an automated basis so that claim can be resubmitted.
And I might just add to that was a great response. I'd add to that on the pre-claim side and on the post-claim side, you see AI helping, whereby before the claim is submitted, it's able to determine whether its likelihood of being declined, and if so, why, so that agents on your side can actually prepare the necessary documentation so that it goes through the first time. And the same on the post-claim side, right? So when a claim is denied, what do you do about it once you receive the denial, right? And then how do you resubmit? So AI is helping in a number of ways on the post-claim side, where it can determine it was declined because of these reasons. Here's what you need to go shore up, and then an AI agent that is, can actually resubmit. So we're seeing more and more advances in AI, deeper and deeper into the RCM processes.
Fantastic. Why is all this so important to both provider and patient satisfaction and retention?
Yeah, I'll start there. I think, the little story I told this morning, which was an actual story, and I knew we were doing this podcast, so I was really in an observant mode as a patient and as a parent. I think for the patient, having that interaction with the clinician and then being able to, once again, go back to the days where people could engage, both the clinician could engage more with the patient, and the patient could feel like the doctor was looking at the patient in the eye. I think that patient experience, making sure you're heard, making sure that interaction is good, is important to patients and clinicians alike. I think also clinicians, there's been so much burden placed on them in terms of increased government requirements, payer requirements, rules, things not to forget, things not to check, that software has enabled them to, and clinicians to do that work, but with ever increasing burden on them to make sure they're checking all the boxes, make sure they're dotting all the I's and T's. So I think AI has a great ability to enable them, I think, as Sanjeev pointed out earlier, to finish that encounter, be done with that encounter, have it documented as they're completing their time with the patient, moving on to the patient and not going home with a whole lot of additional work and a night ahead of signing off on charts and making sure all the documentation is in order. I think there's also a real opportunity, and we're working on this and have a lot of engagement around this in terms of even that ongoing interaction between the patient and the physician office or the clinician office. How do I make my appointment? Who's supporting me when I make that appointment? Does it need to be a human being? Can it be an agent? Can I do that offline in a way that meets my needs in terms of maybe it's after hours, maybe it's during my lunch break, at a time when otherwise I might be waiting on hold with the practice? How do I self-serve in a different way? How does the practice interact with me in a way that an agent can be knowledgeable based on my record, based on my pattern of appointments, so that, again, more and more of that interaction can be done to meet the patient's need in a way that patient and consumer might want it done, and also to enable that work to be done not by a human being during the day, managed by a human being against a set of office and practice requirements, but in a way that can be efficient and effective and satisfying for both the clinician office and the patients who are engaging with their clinician's office and clinicians.
Yeah, great, Diane. So you mentioned the use of AI for retention. The American Medical Association found that 66% of providers use AI in some capacity in 24. Use is only going up, but some providers are still skeptical. What's your response to the providers who remain unsure about the technology?
I think that's a great question, and honestly, skepticism is healthy, especially in healthcare, where patient safety and clinical judgment come first. I think first and foremost, AI is a tool. It's not a replacement for clinical judgment and expertise, and it won't replace the physician and the clinical staff. It's here to reduce friction and fatigue and toil, not take over the decision making. So a good way to think about it, a good analogy, is to think of AI like the stethoscope or the EHR. It supports your expertise, not substitute for it. In fact, the stethoscope and the EHR are both good examples of technology innovations that also came with a healthy dose of skepticism, right? But ultimately ended up supporting the clinician in providing care to patients. So, for example, the stethoscope was the stethoscope received professional resistance in that many doctors initially rejected the tool. Right? They thought that the tool would actually distort the sounds, believe it or not, and so. all new tools, including AI, come with a healthy dose of skepticism. So I say that's fine. It's a good thing. It's also helpful to talk to others, see results, get demos, get trials, test things out. Many providers are already seeing real value, like cutting down charting time and ambient documentation tools, summarizing complex patient histories, as Diane has just mentioned as well. So these aren't futuristic ideas. They're already in use and improving day-to-day workflows without changing the core of clinical care. So it's important, I think, to stay informed and involved and test some of these tools out.
Yeah, we were talking with one of our clients, Morris Heights in the Bronx, and one of their physicians was comparing this technology to the fax technology. And at first it's like the fax, but the fax was really the first interoperability standard. So now you had to look at records from other people. And she's like, that was a big change in medical practice. Now people have learned to practice by, to Diane's point, typing on the computer, and you're having to go back to actually looking to the patient and talking to them and having the notes happen at the same time rather than afterwards. So it is a shift for people, even if it's one that's more efficient and gets back to the patient, it's a shift. So as these healthcare technology or healthcare organizations look to adopt AI-driven tech, what's your advice for them for moving fast but thoughtfully as this technology is so rapidly moving?
As an EHR company, we're seeing increasing push from healthcare organizations to adopt AI, but doing it right matters just as much as doing it fast. And that's why we talk about moving fast but thoughtfully. So we guide our clients to start with high impact, low risk areas like ambient documentation, things that create immediate value without introducing clinical risk. These are real ROI drivers and great places to begin. But what really sets us apart is that we don't just offer features, and we offer quality control. AI in healthcare isn't just about the tech, it's about trust, safety, ethics, and compliance. Our platform includes governance because we know clients need more than functionality. They need really an EHR partner who understands the regulations, risks, and responsibilities that come with AI. So essentially, we don't just ship AI features; we help manage them responsibly.
Yeah, and I would add to that, making sure that whatever AI you're working with your EHR partner, is it integrated? How integrated? Will it actually create the efficiency, or will it create one piece, one part of the workflow or the toil? Will it create efficiency in one place, but add work and burden in another place that is unanticipated? Number one. I think Sanjeev pointed out something really critical there, quality. How effective is the AI model and the AI tool? One thing that we're in constant conversation and evaluating between the product team and the engineering team is saying, we don't sit and saying, okay, we've got a solution. We think it's the highest quality. We think we've done a great integration to reduce that work and toil. But, it's a fast moving environment. So we need to always be current and sort of saying, is there something new? Is there something we can perfect? Are we getting feedback? So I think it's not only a one and done and you do it and you sit it, constantly have to be looking at, it's an evolving environment. Are we doing the best job? Is quality improving? How can we get more and more effective? How do we get more and more efficient? How do we further integrate? And I think really knowing it's not a one and done and you've made a choice, you sit it on the shelf. How do you effectively evaluate on a continuous basis what's available to you? And how do you effectively create that constant change that doesn't change for the clinician, but creates a better and better experience over time?
And not to mention cybersecurity and data security. We could do a whole podcast just on how to manage that when you're thinking about your own environment to integrate those tools. Let us do it for you would be my punchline on that one. It's a complicated space. When you're thinking about thoughtfully integrating AI throughout the care organization or our own solutions, what features or products are you most excited about?
For me, I really, I've been in this environment, never been a clinician, but I've been working in and around them and, on health technology for a very long time. And I do think AI is sort of the the one thing that is really the most exciting technology that's become available to really change the nature of the game in terms of how clinicians work day to day and how that patient interacts with clinician. I think this whole no UI as the new UI is real. I think enabling clinicians to be able to focus on the patient, focused on care, as opposed to making sure they document correctly, making sure they're not, don't have to go at night to redo something, getting feedback about their claim. I think the days of that are over. I think AI will begin to handle and suggest things. And that to me is exciting. I also think there's a whole set of additional work, how you interact with patients or how clinicians interact with patient, how they follow up on lab results and things that are anomalous. There's a whole set of opportunities there that I'm really excited about, so that at the end of the day, a clinician can have the right information surfaced at the right time to make the right decisions with the patient about their health care. I think it will add tremendous value to the patient and the quality of care. I think it will also lower the cost over time of the delivery of health care and the administrative cost of delivering health care in the country today.
Well, I'd add that it probably comes as no surprise that I'm most excited about the AI journey as well, right? The capabilities and the products and the features around AI. So everything from our AI platform to clinical workflows, inboxes, charting, practice management, and RCM, all hugely exciting, will be completely reimagined by AI. And so reimagining these through the lens of AI and new agentic workflows, and not just sort of filling in the gaps in user journeys, right? It's very exciting and appealing to me. Building AI solutions and products with agents that have access to tools like humans do, and the ability to be able to use those tools in an autonomous manner, acting with context on behalf of the clinician and the team to save them time, remove toil, the burden of documentation and administration, automating execution of repeated tasks and assist the physician is hugely exciting. And it's not least because we get to see our products continue to deliver value in real world settings for our clients for all the other reasons that Diane just mentioned.
And simply just stepping back to look at what we've become accustomed to in this environment historically about what it actually takes as a clinician to get paid for the service you delivered, right? Most of us would never, like if we had to wait for our paycheck from our employer and had to go through a series of hoops and making sure everything was accurate and getting it rejected just to get paid, we've sort of acclimated to a really unacceptable environment today. And I think AI has really the ability to create a much more seamless reimbursement process for clinicians that will also, ironically as well, I'm sure there's bots on the, AI on the payer side too. They've created a set of requirements and rules that become complex on their ends as well. So I think that whole just getting paid will become much more simplified.
Let's all hope so. It's ripe. It's ripe for disruption. To your point on the paycheck, it is not easy to get paid as a physician, and it should be much easier. Well, Diane, Sanjeev, thank you so much for joining today's show. This has been really insightful. Listeners, I appreciate you making time to listen to the Ambulatory Healthcare Today podcast. If you're not already subscribed to Ambulatory Healthcare Today, please follow along so you can't miss our next conversation. We look forward to it. Thank you both.
Thanks for listening to the Ambulatory Healthcare Today podcast, hosted by NextGen Healthcare. Never miss an episode by subscribing at nextgen.com/podcast. To see a list of products and services tailored for ambulatory care practices, visit nextgen.com.